for those who are wondering. Lois Pace, I am the President and Executive Director of Global Health Council. We are an advocacy coalition fueled by members from around the world based in Washington, D.C. And we are grateful to be co-hosting this event with a number of partners as listed on the program and on the screen. But to get into why we're here, why we think we're here, we would like to have a conversation about the Global Action Plan. And if you all haven't picked up on this already, this is going to be sort of an undercurrent of the debates here. While not necessarily kind of an official standout on the WHA agenda, it's definitely something that's top of mind for a number of member states and for folks across our community, civil society, and yet there's still some questions about what it is, what it isn't, why we should even care about it, how we can meaningfully engage in this process that everyone is telling us is so important. So thus this event we're having this afternoon. In particular, in addition to kind of getting a brief 101 on the Global Action Plan or where to find that information, we do want to dive a bit deeply into a couple of the focus areas that have been called out in the plan, namely financing, as well as innovation and access. So that's how we've organized the two panels today, but there will be both time for Q&A on those topics following each of those panels, as well as an open Q&A period at the very end of the session. We try to allow plenty of time so that there could be an open dialogue around this, recognizing, again, that there hasn't been a lot of information or opportunity for civil society to fully understand what it is the GAP is. And forgive me, I will start saying GAP instead of Global Action Plan for Healthy Lives and Well-Being as a shorthand, if that's okay with people moving forward. Just a reminder, we do have interpreters, French interpreters, so hopefully I'm speaking slowly enough for our interpreter. Thank you for your service. And if you require a headset, they're available up front. Hopefully everyone has one if he or she needs it. We also have an audience joining us online. There's the camera. I want to welcome you. We believe in being as inclusive as possible with these events, and so we're grateful to be able to live stream these and have these be a part of the record following WHA, recognizing that not everyone can come to Geneva. And finally, we do have a rapporteur who's joined us today as well, and we will be distributing an official sort of record of these proceedings, again, so that we can cast this net and this information far and wide following our time together today. So those are some of the logistics I wanted to get out of the way. Again, this is, we should see this as a series or part of a series of discussions on the Global Action Plan, given there's been limited dialogue. There are many of us in civil society, including the Civil Society advisory group that's been kind of lifted up to assist this Global Action Plan process. We recognize that there really should be more dialogues than less. And so we're grateful for the WHO Secretariat who's here today for hosting a recent consultation in New York. However, we in the advisory group wanted to create space for additional dialogues. And so this is part of that. In addition, I think we'll hear from WHO about the series of events they also have planned throughout the week to help us all better understand the Global Action Plan, as well as an additional public discussion that will take place next month. So a little preview of that before we have them join us here on stage. I think the last thing I wanted to do was acknowledge my advisory group members who were not able to make it to Geneva, but are very committed to this process and this dialogue. So again, greetings to those of our representatives who have been able to join us online, and then to thank our many partners, as well as our sponsors, in particular UN Foundation and Women Deliver, for co-hosting this event today. With that, I'll go ahead and introduce Dr. Peter Singer, who is a special advisor here at WHO, serving in a leadership capacity and spending a lot of his time helping shepherd the Global Action Plan process. We are grateful for his presence here today, knowing that it's just come up on the agenda over at the Palais, so hopefully he can give us some real-time intel on how those debates or discussions are going. But Peter, we'd welcome you to the stage now to tell us more about the Global Action Plan and why we should care. Thank you.
Thank you. I just have a few very simple messages. The first message that I'd like to give you is we totally get it. We understand the importance of civil society. We're listening. We want to engage with you. There's a number of members of the Secretariat here. More importantly, a number of partners. You'll hear from Marika. You'll hear from Seth. WHO is one of 12 organizations who are really working together. And so my first message is we get it. We're listening. As Lois mentioned, there's two things going on at the same time. So I'll be listening by Twitter, and that's at Peter A. Singer. I want you to feel that you could tweet at any time. Tweet me at any time with anything you like about the plan, anything you think could be done better. That's probably the quickest and easiest way to open a channel of communication. So it's at Peter A. Singer. Feel free to reach out at any time, and we will take very seriously your input, and we will take it into account. We'll reflect upon it. We will get back to you. And that's the first message I want to give, because I think that's something going forward that you really need to know we're going to do. Secondly, I want to say thank you. And in particular, I want to say thank you to all of you, because your views really matter. And it takes time for you to come here to reflect on the plan. So just to say thank you. I want to say thank you especially to representatives who are working in country. I'll come back to that in a second. And I want to say a special thank you, if you don't mind, to the 12 partner organizations. And in particular, I know Seth is here, I know Marika is here as representatives of the partners. And I really just want to say from the podium here, Seth and Marika, to you and to the other organizations, this really is a plan about us working together, as you know, and we just want to say thank you for the privilege of being the Secretariat and for being able to work with you. And our job is really to channel what you're going to say, and thank you so much. And maybe we could just give a round of applause, if you don't mind, to the partners. So we're listening. Thank you. And the third thing I want to say is countries. You know, it's called the Global Action Plan, but actually it's about action at the country level. So it's more action than plan, and it's called global, but at the end of the day, the value is how these 12 organizations and other partners, for example, Wellcome Trust, Ed Whiting, you'll hear from, a key partner on the R&D accelerator, how these partners work together at the country level. So 80% of the value, I would say at least, and I'd be interested in Seth and Marika's view as you I would say at least 80% of the value is at the country level. And that's important to realize, because when you hear a global action plan, sometimes it's, and this really is about 12 organizations working in closer alignment, serving national priorities to accelerate the health-related SDGs. It's as simple as that. That's actually the value proposition, which it's the shared value and other partners and civil society and how we all work together. And that's actually my fourth point, which is togetherness. Anybody who reflects upon it at all knows that we can't reach the SDGs without working together. And that is first and foremost national governments who are responsible for delivering results against the SDGs, but supported by our international organizations, by civil society, by the private sector, by a range of actors. So we must learn to listen to each other. We must learn to act together. And then the final point I want to make, the final word I want to say is impact. At the end of the day, we're here talking about processes. These are processes to accelerate impact. But as Seth said earlier today, collaboration has to have a purpose. And it really is the end goal of that collaboration that is vital. And raise your hand if your end goal isn't impact, isn't improving the lives of the people we all serve. Raise your hand if it is. I mean, we have a common purpose, and we will work together towards that end. We're listening. We want to say thank you. The values at the country level, and we have to work together. And I'm at Peter A. Singer, and I thank you very much. Thank you. Thank you, Lois. Oh, sorry, and a particular shout out to Lois, who helped to organize this thing. She doesn't want it, but we'll do it anyway. Thank you, Lois. Appreciate it. Yeah, thank you very much for coming.
Okay, well, while we excuse Peter, I will invite our first panel up to the stage. And as they join us, I would like to read their bios, not in detail, but in brief. So we have Dr. Seth Berkley with us, whom Peter recognized. As we know, Seth is the CEO of Gavi. Really is truly one of those people who rarely needs an introduction, but he's held a number of positions in the U.S. and around the world. You can come up, Marika. Everyone can come, please. Everyone is welcome. And I think one thing that's really interesting in his bio, being recognized as Time Magazine's 100 most influential people in the world, that's not too shabby, Seth. So we feel fortunate to have you here with us today. Since Marika's joined us, I'll introduce her as well, Dr. Marika Winrox of the Global Fund. She's serving as the Chief of Staff there, and she's been there since 2013. And before then, she's also done quite a bit in the world of global health. Excuse me? And serving in the Ministry of Foreign Affairs for Netherlands, but I think quite significantly is very much accustomed to engaging in this way with a diverse group of partners and is committed to gender and human rights and other issues of great importance to civil society in general. I would like to now invite up Joy Pumafi, who's being very shy with me today, or following protocol rather, but please join us as well on the stage. And as she comes up, I'll recognize her as a Botswana national who has served her government as well, served in parliament, as well as Minister of Health. And I know that I first met Joy actually when she was in Washington, D.C. With the World Bank, and so recognize that she's also served at the multilateral level and has been quite influential in the global health space over time. And then finally, we have Dr. Maria Jose Pires Mache, who is joining us from Mozambique, and she is proudly one of our patient advocates here with the Global Health Council, but she can tell you more about what she does in Mozambique and why she cares so much about these issues. So please join me in welcoming our panelists this afternoon. Okay, now I can sit and dispense with the formality. How do you like that? Yeah, exactly. So, as I mentioned before, this part of the conversation, sorry, I don't know if I can really get this closer to me, is going to focus on financing and this aspect of financing within the Global Action Plan. I think my first question is to the two of you who are representing signatories to the plan, and just starting at the beginning. I mean, what is the financing accelerator? What do we need to know about this financing accelerator? What are you trying to achieve? How is it going to help all of us? And what do you still need to bring together whatever it is you're hoping to accomplish as part of this process? Seth, we can start with you.
So thank you so much, and let me start by saying how delighted I am to be here with many of my civil society friends, and you know how important the work we do with civil society is, and I certainly know that's true with the Global Fund as well. The work for this accelerator actually predated the concept of a plan, and it really came from the fact that and all of the organizations were paying attention to transitions in countries. And I think Gavi has a very structured transition plan. PEPFAR had a slightly different transition plan. The Global Fund had a different one. And we had a discussion with the World Bank on how do we deal with this? How do we plan intelligently across the different initiatives to think about that? So that was question number one. But then there were other issues that came up and related to domestic resource mobilization, because, of course, in the process of transition, one has to think about the finance that's available locally. And then the question got raised is, how does one spend that finance locally? How do we think about value for money? How do we think about allocative efficiencies and allocative inefficiencies? And how do we argue? So we began to work by, ending each other's sentences. We would go to countries and we would engage and we would say, well, this is important, and we would agree on those messages. And then we also realized that one of the great challenges was in public financial management excellent. Many of the, certainly Gavi grants have been, ended up going through partners because the government systems weren't strong enough, and it's critical those systems get strong enough, not just for donor funds, but for national funds, most importantly, so they're well spent and that there's not leakage, et cetera. So those were some of the conversations, and so we had already begun it started with Gavi, the Global Fund, and the World Bank. Then the GFF came, and they joined that discussion, and so we began a discussion as the SDG Action Plan, which we welcomed. I mean, collaboration is in our DNA. We are an alliance, after all. We already work with WHO, UNICEF, the World Bank as our core partners, but more with the Global Fund these days. And so that then got put together as an accelerator with the idea that this type of discussion, this cross-cutting information, really needed to link with all of the organizations and frankly beyond, and that's what's important. So, for example, for us, the polio program, which is not one of the organizations, we also need to think about as they transition what happens to immunization programs. And, so I think the point here is collaboration with purpose at the end, to try to increase efficiency, to make it easier for countries, going forward. That has to be our goal, and to increase outcomes going forward.
Well, and can I, as you respond, I'd like to ask a follow-up question in addition to the first one, which is how this should feel relevant to us as civil society, specifically finding these efficiencies.
I think, first of all, it's, in a way, the Global Action Plan, I don't think we gave it so much thought on how it should be called, but it's quite a grand name, and I think it creates an image of that it's more than what it actually is. And this is not going to be the new world order for global health. This is not going to introduce a lot of changes into we look at health. It's a commitment by 12 health organizations with different roles and mandates to work better together, because we know that sometimes there's duplication, sometimes there's different guidance, sometimes we don't coordinate well enough together, and that's creating problems at country level, and that's reducing our collective efficiency. And so we committed to work better together to see where it's most important for us to work together, and the ultimate purpose is to work better together so we can better support countries to accelerate progress towards the health-related SDG targets. And so Peter started at 80% of the value is at the country level. For me, it's 100%. Because at the end of the day, if we have plans that are relevant in Geneva but don't have impact at the country level, if what we think makes sense in how we should work together, it doesn't translate in action at the country level, I'm Dutch, I'm always very blunt, it's a waste of our collective time. And so for me, it really, at the end of the day, we always have to focus on what do countries need, what do countries face when they work with us, what obstacles do they have, and how can we work better together to better support countries. And when I say countries, in Global Fund context, it's always the wide stakeholder landscape at the country level, including communities and civil society. So that as a start. I think what obviously totally agree with what Seth said. And for me, I think what the most important, the Global Action Plan has provided us with a political momentum and an energy to really intensify our collaboration, because we were doing a lot together, but it was also, at times it was ad hoc. Specifically for Gavi, it has helped enormously that we're now in the same building. And Thomas Palu, I don't know whether he is here from the World Bank, we very soon, when he moved to Geneva, he's one of the health finance experts of the World Bank with a lot of country experience. We gave him a badge to the health campus so that he can come easily in and work with our teams. And I think he's almost in the building on a daily basis. So it really, the Global Action Plan and moving into the Global Health Campus did provide us with a very strong momentum to move from what was sometimes ad hoc collaboration to be much more systematic. Where do we want to work together? Where do we have joint agendas? And a lot of it is really it's no-brainers. And that's what Seth said. How some of the key financiers started. That we realized we all are working on sustainable financing, domestic resource mobilization. We transition at different points in time. But we all have a joint responsibility of supporting countries in to move towards sustainable finance. And then if Gavi would come in and say to the Minister of Health and Finance, oh, you have to spend more money on immunization, and then the Global Fund would come and said, no, it's AIDS to be malaria, and then comes the GFF and said, no, it's all maternal and child health. We're going to create a lot of problems at the country level. So we have to have much more a common narrative. We have to increase the overall size of the pie instead of fighting for all individual pieces. And that also means that we have to, and I think that was again the momentum that the Global Action Plan provided, to look at, so if these are then the big ticket issues that we need to work on collectively, then we need WHO for policy guidance. We need the IMF, because if we want to increase the overall pie, we have to increase tax and revenue collection. So it's more momentum, it's a wide group of stakeholders. I think civil society is incredibly important as we implement at the country level, and we have been jointly supporting a couple of national health dialogues where countries really talk about national financing and how to prioritize and how domestic resource mobilization is part of that. We all have been, so civil society in all these countries have been part of these dialogues and the preparation and the event itself. Again, there's a lot of civil society groups at the country level that are working on doing advocacy of domestic resource mobilization. Again, it's where it makes sense to see, like, can we sort of jointly support a number of groups instead of each of us supporting one group who might be advocating for different topics. So for me, the engagement of civil society is absolutely critical at the country level. I think I should stop there.
No, that's great. And I do want to add on just one more question for either or both of you, because you touched on this, this, I don't want to call it tension, but sort of the stumbling over each other that can happen when you're requesting funding for your respective initiatives, and recognizing we're in replenishment cycles or replenishment season to some degree. Can you speak to how that's being reconciled or with this idea of a global action plan, and knowing that it's not a new world order like you're saying? Because I think that's also top of mind for a lot of people in this room.
I think from a donor perspective, it's really important that there is a narrative that makes sense across all of the different initiatives, because particularly it's not going to be the health person or even the development person when you get to the levels that our big sister over here needs from governments. It's the prime minister, and the prime minister wants to know, well, you just came for the global fund, then you're coming for Gavi. What are they doing together? What's different? Why are there two organizations? So what we need is that narrative arc, and that's what we've been working on. And also they need to be reassured that we're not tripping over each other. But one thing that Marika, since I have the mic, didn't mention that's really important is there are other big cross-cutting things that are beyond where we are. So an example would be human resources for health. We all rely on that at the primary healthcare level. It isn't necessarily even the Ministry of Health. It may be the Ministry of Local Government or the Ministry of Planning, that makes decisions, or the IMF, patterns that allow that. And if we want to talk about community health workers, they're obviously shared across many different initiatives. So, from my perspective, one of the opportunities here is to have that discussion across a range of organizations who might help finance it, might help with training, et cetera, but no one of them is going to say, we can fix this problem. This is a shared problem, obviously, with countries.
Fair enough. Thank you both very much. Well, given this focus on country 100% of the time, ideally, I do want to turn to representatives who are or participants of the panel who are living and breathing this work at a country level. Joy, I'll start with you. I would love to get your reactions to what you've heard so far about the Global Action Plan. In particular, there's this sustainable financing pillar. But also curious how you think this plays out, or what you think are the outstanding questions at a country level, particularly among civil society stakeholders.
Thank you very much, Lois. I think like was said right at the beginning, this is about people. It's not about someone sitting here in Geneva in an office and making a decision and hoping that it helps them look better. as they sit in their office here in Geneva. It's really about the people on the ground in communities, what impact it has on their lives, and whether it's actually improving the well-being and of the communities. And one of the tools that we have been working with countries on now is community scorecards, where you actually get the community themselves to assess the impact of these programs on their well-being, and also assess the quality of the service that they're getting, the effectiveness of that service, and the way in which the money is being spent, whether it is being spent effectively or not. And I think this is this to me is just as important as what the two big funds we're just talking about now, about that they should not step on each other's toes. Yes, they must not step on each other's toes. But what is more important, their programs must be fully integrated at community level. You don't have different patients for HIV/AIDS, different patients for malaria, and different children needing immunization. It's the same child who has to be immunized and who needs a mosquito net and who has to be protected against with PMTCT so that they don't get HIV/AIDS. It's exactly the same baby. So these programs have to be fully integrated at community level. So, and that is going to impact the effectiveness of the use of these resources and how far you can stretch the limited resources that are available. So my plea to the Big 12 is that they should also focus on the implementation at community level and make sure that these programs are fully integrated. Seth made a very important point about community health workers. A lot of countries use community health workers, but a lot of the community health workers are also fragmented. We have community health workers for different diseases and different areas. And we had a time when some of the surveillance officers that were used for polio eradication, for example, they were up for grabs, and nobody wanted to actually grab them and use them. And I think that is one of the challenges to the Big 12. Can you not grab and use these surveillance workers and integrate them into the community health networks that are absolutely necessary for delivering integrated programs? I think this is the real challenge now at community level. Another equally impactful challenge is getting rid of out-of-pocket payments, because it's out-of-pocket payments that are actually enhancing poverty at community levels. Now, how do you, the big financing organizations with the expertise that you have, go and actually introduce effective community health insurance schemes or public health insurance schemes in these countries? There isn't a single country on the African continent that has an effective public health insurance scheme. Is it not time that one was actually established with your expertise in order to ensure that the programs that we are currently putting in place are sustainable?
Thank you, Joy. It seems as though that resonated with a lot of us in the room. Dr. Maria Jose, please, I would love to hear from you how you feel this impacts your day-to-day life as you liaise with patients and people accessing healthcare, as you're working in this space on a regular basis, particularly around out-of-pocket costs, budget spending and allocations. Again, these are decisions that affect real people, and we would love to hear from you how you think that actually plays out locally.
Thank you. I wish I could also have someone to translate from Portuguese so I could express myself better, but I will try to. I'm going to speak from the provider point of view and also from the patient point of view. I also had MDR-TB and on the field working with patients with MDR-TB. So we work at national, provincial, district, and at the community level. So involved in all activities related with the patients, and I feel the needs of the patients at their level. So everything was already mentioned about the need of collaboration among programs, among the engagement of the civil society, the commitment of the government, and everything needs to be translated, as it was already also mentioned, in the impact of on the patient's life. So I work with the patients at rural community areas, and if all the plans, if all the policies are designed from the top to the bottom, sometimes it doesn't cover the needs of the population. It has been talked about the out of patients' expenditure. I work with the patients that lives far from the nearest health community. So we can provide, we can have guidelines, provide drugs, have health workers trained, but if we don't think on that patient that is at the peripheral area, that they don't have a chance to go to the nearest health facility to collect the tablet every day in DOTS, to follow the DOTS program. Every day they need to walk far from their communities to go to take the tablets. They face all the side effects, and they have to go back in an empty stomach to their community. So we want to have success on the implementation of the programs, and as it was also mentioned, there is funds from the government in my country. The government contribute with less funds than the external funds, so we rely on these external funds. If these programs or NGOs or the funders step back, we don't have how to continue. There is no sustainability for the programs and to provide health for the patients. So I think that community, civil society needs to be involved. The needs of the patients need to be addressed. The out of the package needs also to be addressed, so that the patients can get their treatments close to their communities. They can early be diagnosed and proper treated, and continue to have the support for their family while they are sick. One aspect that I would like to mention is also the coordination among other ministries and sectors, including the working ministry, to protect the patients while they are sick. So they can be protected, they can stay at home to recover from their disease, but still getting paid and have the funds to provide their needs and the family needs. Because if there is no law that protects these patients, the employers can just get rid of these patients, and they will have to find a way to survive and to find resources for their patients. We want to control the disease because once they are sick, they will have to move from one place to another, catch the public transports while they are still infectious, just to move around to find food for their communities. So one way also would be have activities that provide them income to continue with their sustainable way of living while they are sick.
That's perfect. Thank you, Maria Jose, and thank you for stepping in to join the panel today. We appreciate it. So for my last question, I would like to circle back to Marika and to Seth, because we went from global to local, and I'm curious, knowing that something has been drafted, and it's not quite public yet, but whether or not you could preview for us elements of this accelerator draft that incorporate some of what you heard. Are there one or two elements of the accelerator draft that bring in these themes?
Maybe just to clarify, and it's coming back to what I started with, this is not the New World Order. This is not the global plan that we're developing in Geneva and then rolling out as blueprints at country level. And I think also, to be very clear, this doesn't mean there will be additional funding for health. It's just the commitment is that to work better together, to be more effective together. And it's basically, again, to coming back to the country level, depending on what countries need, what's happening at country level. We're not starting from scratch. Countries are having those discussions. Countries are talking about sustainable financing. Countries are discussing how to reduce out-of-pocket expenditure. And a lot of countries currently, as part of WHA, are thinking about sort of sustainable national health insurance system. So this is not about us in Geneva and Washington saying like, oh, okay, we're going to implement health insurance systems in all countries. It's about if a country wants to implement a national health insurance, if a country wants to expand their community health worker program, so how we can be more effective together and how we work together with our different mandates to support countries in doing that. And if anyone thinks that we're just drawing up plans and then tell countries, okay, this is what we're going to do, that's absolutely not the intention. It's trying to be more effective in supporting countries so that our collective wisdom support countries in making faster progress. And we should start from what's happening at the country level, what the realities are, what the needs are, and how we can best support that.
It's up to you.
Well, I just think it's important. So first of all, the SDG 3 Global Action Plan has not been written yet, just to be clear. It's not like it's ready to go. The accelerator, because work had been done before, we have a more structured approach on some of the things. But as Marika said, it's going to be a continuation of important things that are going to be done. And I think one of the things that's important is we're also having conversations with ministers of finance to understand what they need. And, traditionally, the way health has been thought of is as a cost, not as an investment. And that's a problem because if you talk to ministers of finance, they say, well, these ministers of health they're very technical, they're very smart, they think they know all the answers, and they just say we need it. Why? Because it's good for the country. And what the ministers of finance want is an understanding of the value for money, cost effectiveness of what's happening, the fact that prevention may affect cost in the future. So it's really having that economic case that's there, and then in tough resource involvements, making those very tough trade-offs that exist. And so, as Marika said, this has to be at country level. It's not a global issue, but it becomes very important. And let me give you an example. UHC as a concept, who could be against UHC, perhaps except my country, but all joking aside, the concept is good, but what does it actually mean for every country? And one of the things that could happen that is a challenge if what this means is, to keep people from tipping into poverty, which is an important issue, we need health insurance schemes, and I think we all could understand that's important. But if you take money away from prevention and primary health care to pay for insurance schemes for secondary and tertiary care, you actually have allocative inefficiency in terms of expenditure. So we really need to get into the granularity of it and talk about equity and talk about the importance of supporting the community. And that's where your collective voices are so incredibly important because, we have slogans and they're important and they're right as slogans, but it's what happens at the ground that really matters. And on the financing stuff, it's really critical. If people are paying for everything out of pocket, it's just not sustainable. So these are, I think, the important points that we really need to work on.
Thank you very much for answering so candidly and just being with us today. It really is a sign of your commitment, not just to the process, but the purpose of that process and working with us on that. So I do want to express my gratitude to you both as well as to our other panelists. I want to turn it to the floor and also to the audience online to see if there are questions from you regarding this particular topic of sustainable financing within the Global Action Plan. Questions? There's one here and one there. Okay, we'll start with you and then I'll come.
Yeah, thank you very much, all the contribution. My name is Andreas Wolf from Medico International in Germany, and I'm also with the Geneva Global Health Hub. Maybe a bit challenging question to all of you, because the title of this event is Community and Civil Society Engagement. And I heard it from Joy that the idea of that communities actually are also monitoring success of this and monitoring how money is spent. I think this I find the very crucial elements. And of course, this is not easy. And of course, it also needs funding. And I really wonder how much, and I think to bridging this gap between like an alignment of finance institutions on the top, and then to see what is really possible, like how communities can monitor this. I think this is something we would like really to see very strongly, and would also like to have some accountability mechanism built in this finance accelerator, so that we really, at the end of the day or within a few years, at the end of 2030, we can really say, okay, this has worked, then this was really something. Thank you.
Thank that. I'm going to go to the gentleman here and the woman here, and then we'll have some responses, but then I see Susan and some other hands in the back. Thank you.
Great. Well, my name is Bill S. Jala, and I come from the Republic of Liberia. And I am a part of the campaign Speak Your Mind on Mental Health. And my questions are, the first one is, how would our world be if we heard that there was an evidence-based effective treatment for mental health issues that has threatened 1/4 of the world's population? Number two, what is the UN global governing body thinking about mental health? And my final question is, what investment strategy is being put in place for mental health? Thank you.
All right. Thank you very much. And then finally.
Yep, there we go. My name is Nadia Cobb with the University of Utah. Thank you very much for a very inspiring conversation. I'd like to ask a question. We seem to be very focused on certain types of health workers. For instance, the community health workers, which are undoubtedly critical, but everything seems to be focused upon one group. So we're siloing people. And truly, to be effective in healthcare, it must be the chain. It must be every single link within that chain. And what I don't hear at most of these events over the years is really talking about the skills mix, and particularly the primary healthcare workers that are at the community levels that the community health workers work with, the clinical officers, the medical assistants, the community health officers, these mid-levels or non-physician clinicians that really need to be brought into these conversations because they're the ones at the core providing the primary care in the skills mix. Thank you.
Thank you, Nadia. I'll turn back to the panel to respond to the various questions. And to review, there's a question about the bridge between sort of global alignment and local accountability. I wonder if Joy could touch on that, but also have one of the global actors speak to that as well. We have several questions on mental health, but I'd like to focus on your third one, which is the investment case for mental health and maybe other priorities, emerging priorities, I suppose. And then there's this final question on health worker mix in terms of sustainable financing, whom we're funding and how we're allocating dollars or monies for those workers. So Joy, would you like to begin?
Sure. With regards to engaging communities effectively and how you can also address, the budget and financing issues. We tend to underestimate the ability of communities to understand financial information. And I don't know a single mother who runs a household who does not know how to do a budget, a simple budget. And it is very, very easy if when you are doing a community scorecard to also have information posted on the board in the health facility on what the budget is for that facility and what the budget allocation is, so that they can understand how much is supposed to be spent on what, and then they can and if you have a quarterly update of that information, the community is able to sit together and actually make very, very informed decisions. I can give you a few examples in Ethiopia, in Amhara region, where they are already doing this, where they have community scorecards, where the communities decided that because not enough money was available for ambulances, they were going to do resource mobilization themselves. And so they would, for every ambulance that they were able to mobilize resources for, the government would buy another ambulance. The government was able to put in place an insurance scheme, a health insurance scheme, which helped them pay for some of the services that they would otherwise not have gotten if they had not identified that particular gap in the health services. They were able to get more health workers, and they were able to repair, maternity wards, for example, that were dysfunctional. They were able to have clean water supplied to facilities simply by assisting in identifying where the priorities are for them as a community, and a little bit more different budget allocation, but also identifying other sources of financing with government. So I think we had a very good principle at the beginning of the HIV/AIDS epidemic, which was nothing for us without us. And this does not only apply to HIV/AIDS, it applies to all of health. And I think we need to remember that. It's a basic principle that must be applied across the board to all health services. And then we'll be able to identify some of the problems that my sister was talking about here, when people are taking medication without food and walk long distances in order to access care. I don't know whether I can answer about an investment strategy. The big guns are here next to me. I think they can talk.
I think that's a good segue over to either of them to speak to either accountability or investments in other areas.
Let me just answer one further question on this issue of CSOs and accountability, because I do think it's an important question. Our focus with CSOs is mostly on helping at country level and delivery and advocating and working and reaching the unreached. And we work with governments to try to make it sustainable, so the governments will acknowledge that and use their financing to do it. We don't have a separate fund for watchdogs, and this is a challenge we're discussing with our civil society constituency on how to do that, because it is important work. We're not set up for that, but it's something that I think we do have to think about. I think the Global Fund does that better than we do. On the mental health, that's about the issues of the overall health architecture and why it's so important that this work is rooted in the normative agency of WHO. Their job is to work with countries to make sure that care is comprehensive and they're thinking of all aspects of that, including helping countries make their own prioritization. And so I think at the end of the day, when we talk about primary health care, which will be the last answer, obviously that should include people who have the skills to manage all of these, but those standards, that work has to be done through the normative agencies working with those governments and with local agencies. In terms of the question on workers, I use the community health worker just as an example. I mean, for vaccination, we're concerned all the way from the minister to the technical agencies that are there, to the supply chain, to the regional medical officers, to the local, to the nurses, et cetera, all the way down. And one has to assure that that works at every level, including trainings and skills and new techniques that allow them to be, get courses done digitally where they are. I think the challenge is that pluripotential nature, because they're not only doing it for this, as Joy said, they're delivering bed nets, or they're delivering antiretrovirals, or they're doing other things. So the challenge is, how do we align on that and help support them, through governments to be able to do that? It's not just one catter that's important.
It's up to you.
And well, little to add to what Joy and Seth said, but just to reinforce again that this global action plan, we should maybe come up with a different name. And because this is not, again, us deciding how much money should go to mental health, or how countries should invest in human resources for health. It's about us being more, working better together. And sometimes it's really very small things that are almost too stupid to mention. For example, if you want to work towards sustainable finance and increase domestic funding for health, you have to know what countries realistically can spend in health, so that you do a fiscal space analysis. And there's an unfortunate example of different organizations that did a fiscal space analysis at the same time in a country using different methodologies, coming out with different outcomes and providing different guidance. And those are the sort of stupid things we should no longer do. And so already what happened was that there's now sort of agreement on, if you do a fiscal space analysis, how do you do it? And not have different agencies doing the same thing in a different way. And so it's the simple things like that can make life easier for countries, hopefully, and make our collective support more effective.
I love it. Good takeaway. Don't do stupid things anymore. Easy enough.
Not easy.
Well, yes, sadly, not as easy as it should be, but a promising goal all the same. So I've had time called on me. I apologize to people we didn't get to in this session, but it's partly because we want to get to the next panel and leave time at the end for some additional questions. So hold those for now. I'll quickly summarize, what I heard. This is not about a new world order. I think that applies across the Global Action Plan, not just this particular accelerator or focus area. I also heard, to that end, it's probably more about reframing or a new narrative around how each of these groups come together, and recognizing there's already cross-cutting areas and activities across the 12 agencies and even beyond the 12 agencies with regards to financing and other areas. And then finally, this commitment to civil society and our engagement in this process, and in particular, the way our role in holding actors at the global and national level accountable for these commitments in this way forward. So with that, again, my appreciation to all of you for joining us this afternoon and sharing with us your thoughts on this particular piece of the plan. And I will pass it over to Kate to transition to our next panel.
So thank you, Lois. Thank you to our fantastic first set of panelists, to our fantastic comments that we've already heard from the floor. My name is Kate Dodson. I'm Vice President for Global Health at the UN Foundation, and I'm going to get right to it in moderating the second panel, because not only do I want to leave time for the panelists, I really want to make sure that we leave enough time to hear your perspectives, your questions, but also your feedback. This second panel is designed to be about advancing innovation and access through the Global Action Plan, and I was really inspired by a lot of what we heard, especially from Joy and from Maria Jose say about where they're seeing the struggles of community engagement, but they're also finding tools and opportunities for innovation. And I want us to open up our sense of what we mean by innovation, both through this panel conversation and through your comments. It's not just about the new flashy widget. It's also about tools like budget transparency and a primary healthcare clinic that allows citizens to hold their governments to account. I have three panelists who are going to join me for this conversation. I'm going to invite them up just briefly by mentioning their name and their role. First, Ms. Rosemary Mburu, who's the Executive Director of WACI Health, probably known to many of you here. Welcome, Rosemary. I'm going to invite, please. Ms. Jyotsna Roy, who's a patient champion from India and also works with the NADA India Foundation. And Mr. Ed Whiting, who's the Director of Strategy at the Wellcome Trust. Welcome, Ed. And I'll join my panelists at the table. So great. And here I want to, we heard a lot in the first conversation about putting people at the center of care. So I'm going to take that to heart. I'm going to start with Jyotsna, who you're here not only for your work with the NADA India Foundation, but also as someone who's been living with a chronic disease for quite some time. And as we think about access, there's a lot of different ways that we could unpack the question of access and what it means to provide better access to people who need care in whatever form that is. So I want to ask you, from your kind of experience, if you can tell us a little bit more about the challenges that you see in access, and then some perspective on the role that partners who want to work together to support people and patients at the center of care can do to overcome those bottlenecks and those challenges in access.
Thank you. And I'm very happy to be here. And in my personal capacity as a person with an NCD, and also as a person who works with others who are in similar situations, not necessarily the NCD that I have, but in others as well. I'm primarily a social development practitioner, and I worked in international development. And one of the things that I learned in the last 30 years of my work was that health is not just a medical issue. Health is a social and a culturally embedded happening, and also that it has economic implications, which determine the access question that you asked. Right? One of the things that I encounter a lot is people who are ill or who think they are ill do not, and especially, and we are looking at, and I would like to talk about NCDs because that somehow gets a little bit pushed aside because these are long-term morbidity issues, and others are also important, I'm not saying that, but NCDs which include like rheumatoid arthritis, diabetes, hypertension, and mental health, and other things like substance abuse is also becoming a very, very important NCD that we are encountering. And one of the things that we do with NADA India, I volunteer with them, I don't work with them, is that we look at people who have alcohol dependence and also substance abuse. And that is a very, very, very fragile and at-risk category of people. And now, at least in the South Asian subcontinent, I can say that this particular NCD, I think, which is now included, is getting more and more rampant, and getting aid to them, getting them to accept that there's a problem is very, very difficult. And getting them to access the facilities that may be available through the government system or through the civil society system or through Good Samaritan systems is very, very difficult. And also, these are cost, as my friend earlier said, that these are also implications for the livelihoods of people, because a lot of people who are dependent on these kind of substances are the ones who are the breadwinners of the families. And more, and the second thing that I like to say is that health is also a very hugely gendered question, which we have not talked about in other places. So I heard about the gap, and this morning when I woke up, it was ringing in my head that gap, please look at the gender action plans as well. So gap, please include the gap as well. So that's what I want to say.
Great, thank you. Rosemary, I'm going to turn to you next. You have a wealth of experience in trying to open up spaces for civil society engagement, not only at country level, but globally, and also for researchers in the research agenda. This accelerator, in particular around innovation and access, also has to do with a research agenda. And I wonder if you can speak to, the experiences of and the kind of priorities that you would place on enhancing access and opportunity for researchers and for a research agenda to be better delivered, deployed at country level.
Yeah, thank you so much for this. I'll start by reflecting on how research, innovation and access is seen at the country level. So we know and we acknowledge that research for health is going to be very important and very critical for the achievement of all the health-related SDGs. And for that to happen, we know that the ultimate success of that and whether we see anything coming out of that and whether we celebrate or not is going to depend on whether we use the evidence we get from the research to inform policies at the country level, to inform development of strategies, to inform innovation at the country level. So if the research we're investing in doesn't translate into that, it's not going to be a success at all. But the practice and what we see mostly at the country level is that evidence from research is rarely used for policy, it's rarely used for decision making, it's rarely used for decisions around finances. So having established that gap as civil society, then we see a very important role and critical role for civil society to play around a number of things. And that's what I want to look at. A number of things, including, number one, the issue around priority setting. So we know that very few countries actually have research agendas that they have set up. And we know that countries should actually have those in a way that helps us at the country level to prioritize what is important. And this needs to be informed by the burden of disease, by the different conditions at the country level, and all that. So when that misses, then you run into the risk of having priorities that actually do not speak to the diseases or to the epidemic or to the burden in that particular country. What we see a lot of times is that civil society and communities are left out when it comes to priority setting, when it comes to conversations about what are the critical priorities for research, for innovation in the country level. So priority setting is very important. Some countries, through the ministries of health or science, technology, and innovation, like in some countries, have come up with structures of how stakeholders are involved. But even within those structures, you find that civil society is either not at the table. But there are times when civil society also is on the table, but we haven't invested very well as a community of stakeholders to strengthen the understanding, the capacity on engagement around R&D, innovation and access. So that's an area that we need to work on. The other thing and big thing is around equity. When we talk about R&D, innovation, and access, I think the biggest issue for us as civil societies and communities is to ensure that the products that are developed out of this process are also allocated in an equitable manner, and that communities or civil society or any person that needs to access these products does that in an equitable manner. I also am a member of the Civil Society Engagement Mechanism on UHC 2030. And one of the things we promote is around leaving no one behind. And in leaving no one behind, we also believe that it should be the farthest left behind first. And so at the country level, that question needs to be answered to say, once we develop certain products or once we see the benefits of innovation, who should benefit first, or who are our farthest left behind populations at the country level? So countries need to answer that question. But how can countries answer that question without involving communities, without involving civil society? Because it has to be to the people that this question is taken, and that involvement has to be there. The issue around accountability and civil society participation. I'm reminded in the early days of the HIV response, there was a lot of skepticism around community involvement, community engagement. But if you look at the track record of countries that made success, that made breakthroughs, it is countries that actually invested in their communities, involved their communities, and where there was genuine participation of communities. The world said that Africa could not use ARVs because Africa could not tell the time and therefore could not follow the time. And communities, it was civil society communities that actually pushed to say, no, we can tell the time and we can take ARVs. So it was the voice of the communities. Governments in different implementing countries came up and said, no, this is not a priority for us. But it was communities that actually, through the national voice, stepped up to say, no, we need to address this. It is urgent, it is serious. And the last thing is the issue about demand. So for research and innovation, R&D and innovation, it is not as a civil society representative or as a community member. This is not something I hear in our domain a lot, research, innovation, and all that. It's something that I think we have seen as belonging to scientists for a long time. And therefore, the demand from our end is very minimal to say that R&D and innovation is very important. So I think civil society and communities, we also have a role to work around raising the public demand, because unless that is a public demand, you will not see it as a priority in our budget, because civil society and communities push for what we believe is urgent, is a priority, is demand. So I think there is also a role there for those of us who believe in the importance of R&D and innovation and access to actually raise the public demand so that we can begin to get this into national budgets, into national priorities, and into conversations. Yeah.
Rosemary, thank you. I think we could take that in a lot of different directions, and I'm eager to as we go through the conversation. But first, I'm going to turn to Ed. As you hear what Rosemary and Jyotsna have shared about, the challenges and the imperative of engaging communities in conversations around research, access, innovation. The Wellcome Trust is co-facilitating this accelerator for the Global Action Plan. How are you trying to kind of think about ways that these global actors can help bring together, support, bolster those kinds of efforts?
Thank you, and thank you for the invitation today. Tiny housekeeping point, we're an hour in, and I know there's people who've been standing for about an hour, so if anyone wants to do some swapping around and some people want to stand up and so on, the seats at the front, please feel free to either find or forcibly move people from seats so that everyone can have a seat. Another quick housekeeping point, if anyone wants to go even deeper and wants an additional thing on your agenda, because this week is just too quiet, we're hosting a side event on the R&D Accelerator tomorrow at the Intercontinental Hotel at 5:30. Team Wellcome are here. Please raise your hands. Please talk to any of the people currently raising their hands, and they'd be delighted to ensure that you can attend tomorrow. And we'll have the WHO there too to talk about it. So we're in a slightly odd position that we are definitely not one of those 12 organisations. We were invited by the WHO and the World Bank, and we're delighted to be invited as an observer. initially with the Global Action Plan. And when this idea of an R&D accelerator came up, we thought actually as a funder of research and a lot of discovery, basic and translational research, including some programs in low and middle income countries, we might be able to help, firstly, to offer some thoughts, but secondly, to provide a bit of a sort of a neutral convening space to talk about this stuff, which can be quite tricky. And Kate, to your first question, a lot of these themes feel very resonant to the research community. This question of how to involve patients in the production of innovative products and new ideas, and then to build demand, Rosemary, as you were saying, for those ideas that could potentially transform the trajectories of health from those people who will sustainably fund those ideas. That's kind of what researchers and scientists and so on have been trying to do in health for a long time. Congratulations. And that felt like actually when we were talking about this and we convened a meeting in Kigali a fortnight ago and we talked about this felt like some of those common issues. Now, you're absolutely right that the scientists haven't always done a great job at connecting with civil society groups, and the AIDS epidemic is a great example of, firstly, how science didn't get it, but then how science did get it. And actually making the connection between research organisations and country-level prioritisation is not always done as well as it could do. So briefly, what we've been talking about in the accelerator, and we're really pleased that there will be a full consultation on the emerging ideas, and they are very emerging ideas. And as Marika says, this is neither global nor action nor a plan nor whatever. It needs a completely new name, but it will be the start of a process. The sorts of things we've been talking about have been firstly to start with the National Health Plan, and ideally the National Research Plan, but that's not always there. But then also create a bit of a gap analysis between that health plan and the SDGs at a national level, and get everyone around the table and say, well, okay, how can the ideas that we know exist and that are evidence-based and already proven to a degree help to span that gap? You know, how can innovation help to make up the gaps where you find them? And then how can you work together so that the government funders feel a real stake in the game and they're likely to sustainably fund those ideas into health systems, and you don't have a world where you have the Seattle, London, Geneva people going, goodness, this is it. This is the thing that will turn everything around, which is often untrue anyway. But how can you form that partnership from the word go so that everyone is around the table early? We had some examples at the meeting that we ran a couple of weeks ago. In Kenya, there was an example around visceral leishmaniasis where the government, health authorities sat down with the KEMRI Institute that we fund from Wellcome and said, well, look, what are you doing? What can you do? They funded some trials. And then because they sat down at the start, the government then funded scaling of the findings from those trials. And then the government also helped with KEMRI and with others to make sure that we had the right trial participants so that once you do start to scale, you know it's more likely to work. So for me, there are some themes about how we bring together organisations. We start with those sort of shovel-ready innovations, but in doing all of it, we kind of never lose sight of the patients who are the whole point of this whole thing. And for me, the thing that I struggle with as someone still quite new to global health and new to this setting and so delighted to be here is that sort of the patient involvement, which you totally do with research, and the broader sort of civil society question and the organisational questions of when and how to engage the broader groups. So that's something I'm personally grappling with. I know we're grappling with in terms of how to make this work. And it's something where, you know, we'll be turning to all of you and actually all the patient groups around the world too for that insight about how we can get it right in this accelerator. And I promise to stop there.
Thanks, Ed. Really appreciate that, and including the example that you just shared from Kenya as well. I think it's helpful to kind of see how that could play out in the future a little bit better. I'm going to go back to Jyotsna and Rosemary before we open up to comments from the floor and ask if, you know, as you think about the perspectives that you bring into this question about enhancing the research, innovation, and access agenda through the Global Action Plan, what are the top 3 things that you would ask for of these global partners? Is what Ed's talking about here is kind of part of the contemplation of how they're trying to think about this based on national research agendas, national health plans, et cetera. Is that sufficient? Does that feel right? I'm not to put you on the spot, Ed. Put all 12 on the spot who are part of this Global Action Plan. And do you feel like, you know, are there 3 things that you would like to say as they're still pulling together their thoughts about ways that they can help enhance the space, the opportunity, the financing at country level to improve these issues?
So I think first of all is to acknowledge that the 12 organizations have set up an accelerator specifically for civil society. So that is something we appreciate. And that also is one of the asks, to say that even though there is an accelerator specifically looking at civil society, that we may meaningfully engage civil society, and we take seriously the recommendations from the Civil Society Accelerator. So that's one. And then across the accelerators, like what we are talking here, Accelerator 5 on research, innovation, and access, to also really look at meaningful engagement of civil society within that. Of course, there are advisory groups that have been set up that include civil society, but actually meaningful engagement and taking into consideration civil society contributions is very important. Two specific asks is to say that in September, before the submission of the report to the UN General Assembly, it would be very useful for civil society and communities to see that report and to provide feedback at country, regional, and global level. So I really hope that the institutions can offer that opportunity for civil society and communities to feed at country level especially. And the other one is to say that after September, once the report has gone through the UN General Assembly, and the conversations around implementation start, so it will be important that civil society is also involved right from the start in terms of contributing to the discussions on implementation and accountability. Yeah.
Great. Jyotsna.
Yeah. You know what, because this is the first time that I'm really listening to all this discussion about on the gap, the Global Action Plan. So I have to get my head around it, and I've been trying to do that since the last few days. A few thoughts on what we would like to, as the civil society, because when there are many, and I'm not saying that there are funds coming in from different sources and there'll be a rain of funds in different countries, but one of the things that we grapple with, and I've been a donor as well, and then people have said that, we have so many donors, and how do we kind of streamline the reporting, the planning, and the monitoring mechanisms? So that will be something that would be expected from the civil society to this group that is putting together this fantastic, and I think that this is the SDG 17, which is like partnerships for. So this is SDG 17 for SDG 3. I think that's the way I try to put my head around this. The other thing that I would like to look at is, or like to flag is, since it is health, so there are many items for procurement, and that is another thing that people get very flustered and flounder. The civil society gets very caught up in that, and then there are leakages and stuff like that, and that goes to the accountability, transparency, and the internal mechanisms part. And the other thing that could be facilitated in the civil society, because I heard our sister Joy, she talked about the scorecard. Then there are, I was in Afghanistan, and there, Afghanistan always brings up this idea of, everything is chaotic. But there are friends there, the Integrity Watch Afghanistan, and they are monitoring the community-based monitoring system they're using for health, for extraction, for other things that are not the concern here, but they're using it for health. And they have had good report back to the government, whatever that can influence there. So there are different mechanisms through which we can learn from each other, and that could also be facilitated by this fund, if that comes through, if that comes to supporting. As far as India is concerned, and I come from India, and I have to speak a little bit about it, we say that we've got the best universal health coverage plan at the moment, which is called the Ayush plan, Ayushman Bharat, like long live Bharat, that's what it means, long live India, that's what it means. And their primary health care is like really at the center of the whole plan, and then there are good allocations for it. One of the things that also is very inspiring for me is that we've been talking about well-being for a very, very long time. And now that gets reflected into the health plan and the health agenda. So that is something which looks at more holistic health and not just looking at the pharmaceuticals and the industry, but there is a lot other complementary systems or real systems that have worked. And that I speak from my experience. I went for aggressive support, and then I chose my path. So that is the other thing, the patient empowerment, the patient advocacy that we talk about. So that we have to think about. And the farthest and the foremost is the political will. And I think even Bruno, our friend, the three of us, the political will has to be there, whatever good plan you have and whatever good research that you do. Because we have metadata. Like I was part of the Census of India, which counted 1.2 billion people in 2011, after which I fell sick. So we have this huge amount of data. We have the National Family Survey. So there's a lot of data, but then there is the secondary part that needs to be done is how do we process it and what do we make of this data? Who's using the data for what? So that's the other thing to look at. And that's where civil society can come in, because we have our feelers and our ways into the communities that we're talking about. And that's where we can get closer to the people. So there could be many, many thoughts, but thank you very much.
Great. Really appreciate those recommendations. I'm going to briefly and fleetingly take moderator's prerogative because I spotted someone in the audience that I want to call on first and ask a question to them. We've heard a lot in the course of even just this past day and a half since the World Health Assembly really got going about the WHO transformation agenda and we've even heard in this conversation that WHO needs to be able to step up better, listen to the voices of non-state actors, especially civil society, and engage with them and support models and mechanisms for engagement for civil society. So Gaudens Silberschmidt, who's the now Director of Partnerships at WHO, I saw you in the audience. I want to ask you a question about that and how WHO is starting to and plans to walk your talk around enhancing engagement with civil society, providing space for civil society engagement, especially at country level, and also in a forum like the World Health Assembly.
Thanks, Kate. Indeed, we are shaken and transforming. My own role has been changing. We used to be Director Partnership and Non-State Actors. I'm since 1 week Director for Health and Multilateral Partnerships. That means we split the accountability of the framework of engagement with non-state actors, which goes to compliance, risk and ethics, and the promotion and coordination, which will be in my new department. And there we certainly have a lot to do. We will build on what the UN Foundation has been leading on the CSO task team for recommendation, but also what others such as G2H, H2 and others have been bringing us as proposals, and on what Tedros says, from risk aversion to risk management. That doesn't mean risk blind. It means managing the risks, especially through training at the country level, because being that normative agency that we are, rightly so, our people were saying, oh, let me be careful. And sometimes they said, oh, I heard country directors saying, better don't engage. So we have first and foremost a huge training effort that our people across the organization, but especially at country, engage much stronger in a risk managed manner. We will build that also through a NGO engagement strategy, which we will elaborate this year. That means we have the policy, what we are doing, but we need the strategy of doing it more and stronger. We will look at what kind of advisory group, as recommended, will be set up in the context of that strategy. But then we also look on how giving more voice at the global level. Those following the governing bodies closer have seen that the executive board, there is a paper on involvement of non-state actors in governing body. The challenge there is all member states want to give more meaningful engagement, more meaningful listening, but time of crowded agenda makes shorter and shorter statement. They don't go together. So picking up to conclude on the topic of the panel, innovation, we need your smart thinking, and there will be a consultation later in the year on it. We need your smart thinking on governance innovation. How can we be more meaningful, but not more lengthy, where member states switch off and don't listen anymore?
Great, thank you, Gaudens, and appreciate your nimbleness. So I'm going to open up for broader questions, comments from the floor. I see here one, then two with the stripes, and then three
here. You can hear me, and I'm loud enough. Good afternoon. My name is James Kamau from Kenya Treatment Access Movement, and also Global Advocacy Network, Global Fund Advocacy Network. My point, and I would like Rosemary to put more emphasis on it, is that yes, it is true about civil society. When Global Fund started, and I believe we have Chief of Staff from Global Fund here, it was a community-based agenda, and that is how come it came into place. And I think it's important for us to understand where we come from and where we are going. And I think it's what community can do is on record, and we need to have more participation on the issue, especially also on issues of accountability. Ed, you've talked about funding of research to Cambry, which is good, and everything else. I want to ask you a genuine question, which I would have asked Gavi, but they have taken off. There was misappropriation or setting aside of funds that were given to Cambry, and the government of Kenya had to come in to pay before Gavi could continue funding. And those kind of issues are there, especially when you give to organizations like that. What accountability measures do you put into place for the corruption measures, and what needs to be done? And how can you engage as a civil society? Because sometimes you decide because it is through government and everybody else, you don't involve us as civil society, yet we are the ones who can raise, the red flag. How can you do that?
It's okay. Hi, Jamie Bainishi, Director of the Global Health Technologies Coalition. First of all, thank you so much for highlighting and prioritizing innovation as part of this broader dialogue. We focus a lot on the advancement of drugs, vaccines, and diagnostics for low-income and low-resource settings, and so it's through that lens that I asked this question. We're often thinking about, when we go from the macro level, whether we're talking about the SDGs, whether we're talking about WHA, we have the grand commitments at the 30,000-foot level, but then at the end of the day, it's the member states, it's the individual countries that need to drive the change. And we're always asking, and I'm really curious from each of your three perspectives and where you're from, when you go back to your countries and say, what do you need to do to advance the innovation agenda? I mean, is it strengthening laboratory capacity? Is it strengthening research facilities? Is it regulatory harmonization? It would be really useful, I think, for those of us who work on this at a global level to hear sort of individual and specific perspectives about what countries can be doing.
Thank you very much. So this is Sami, Head of Health Programs in Save the Children UK. And I wanted to pick up on your point, Ed, regarding the innovation accelerators, because we have set up one, actually, in Save the Children as part of our global partnership with GSK, which tries to kind of describe, to do what you've tried to describe, which is to kind of bring an early discovery R&D type organization with an implementation organization that understands communities' needs, so that supply matches demand and research is driven by need, effectively. There seems to be lots of accelerators mushrooming everywhere. So I guess my question to you is do we have a risk of kind of fragmenting the research agenda by kind of having those accelerators competing with each other to some extent, or is it actually a good thing and the more the better? It's not clear to me which direction we should try and go.
I'll invite each of you to comment where you feel comfortable, and then I promise the next round I'll go to this side of the room, so I didn't neglect you.
So I'll take two. One from James about community involvement, strengthening that. And I would say that as civil society and community advocates who are working around R&D, health R&D, innovation and access, we have taken it upon ourselves to organize ourselves in coordinated and well-facilitated community groups and civil society groups. Just an example, we have the Coalition on Health R&D in Kenya. We call it CREED. In South Africa, we have South African Health Technologies Advocacy Coalition. We also have the African Platform on Access to Medicine. So just giving examples from my region, which I know. So just to say that I think as civil society, that is what we are also offering. And that's what we are bringing on the table to say we are organizing ourselves, we are coordinating and updating ourselves and working around capacity strengthening or unlocking capacity among ourselves so we can better engage on these issues. So that's how like a contribution we are bringing to this. And the other thing is to the question on how can we make progress on innovation at the country level. There are so many things we can do. For me, I would like to highlight two. One is the issue around demand. If the public does not think innovation is important, there will be no innovation because the public does not make an outcry to say we need this. So we have to get the public to demand this, just the way we demand water, just the way we demand the basic things, education. We need to be able to say that we will not achieve the SDGs without R&D, without innovation. And that has to become part and parcel of what will get us closer to the SDGs. The other thing I would like to talk about is funding, to say that there are so many ideas, even in our continent. There are so many things that we have evidence that certain innovation can work. The biggest challenge is scale up of that. And for you to achieve that, you need a number of things, including funding, including a priority list of what do you have evidence for and what do you prioritize, given we don't have a whole bunch of money for that. So in terms of resources, it's important that countries, international funding is important, but also domestic funding is important. So those two have to play together. So I think what needs to happen is increased funding for R&D, innovation and access issues, but not just international funding. We also have to see more leadership from the country level in terms of domestic funding. Yeah.
Jyotsna or Aaron, do you want to go first? Thanks. I'm responding to the question the lady raised. You know, one of the, talking from the India perspective, and India is like really large, so yeah. So, and also because there are lots of different dynamics there. So one of the things that just struck me is the challenge is this interministerial thing, because health is not just situated in the Ministry of Health, because the implementation is done by so many other different ministries, right? The Ministry of Women and Child, the Ministry of Food and Agriculture, etc., etc. So interministerial coordination is one of the, it happens, there are these tiered fancy bodies, but when you really see it on the field, then it's a little bit of a challenge. So that's one of the things that I would look at. Then there are these regulatory mechanisms to think about. That's the second thing. And then the capacities that we need, because we have to reach the last person, the inclusion aspects that we talk about, and not the siloization of our health programs. So for that, we need huge capacities. And now there are many systems in place already, you know, especially for mother and child care. But it was very unfortunate that this morning I read that we have the highest under 5 mortality rates. So that breaks my heart. So we have to address these things. So capacities increasing at all levels in the Ministry of Health, in the Ministry of Women and Child, in the Ministry of Food and Agriculture, in the Ministry of medicine and whatever we have, pharmaceuticals we have. So all that. And we have another ministry which is called the Ayush, which looks after the or the traditional systems of healing that we've had. So we have a ministry there. So that also needs attention. That cannot be excluded, because majority of our people, and including me, I go to them for my well-being. Yeah. So that's another thing to think about. And talking about funding, there is funding from outside, yes, external donors and others, multilateral funding, but the Government of India and the Companies Act has mandated that all companies use 3% of their 3 years average profits for corporate social responsibility, we call it, right? So the maximum, I think 69% of the funds in the last 3 years have gone to health issues. And there they are looking at supporting innovations, incubation, and also health practices. So actually, health services are being delivered, maybe in the private sector, but also there are lots of innovations and other things that are being supported. And then use of technology. We have also started, India has, and with Africa as well, we use telemedicine now. So reaching the unreached areas is very possible through telemedicine, and that has been successfully happening, because a lot of patients, a lot of people come to India for different medical reasons, and they are followed through telemedicine from certain really good established medical facilities in different countries as well. So that's another thing that is happening, which could be part of something that you would discuss. Thank you.
So some very specific questions, which is excellent. Jim, thank you for your question about KEMRI. As won't be a surprise, I'm not going to offer a detailed commentary on an individual case, but you asked quite rightly, what are our accountability mechanisms and how do we deal with the challenge of corruption? And it's a challenge on all sides. The challenge of doing research well, the challenge of spending money well. In many countries, most research systems, you will find people who will not necessarily work for everyone's benefit and everyone's good. So we need the best possible systems to work with that. And we also need to be honest about the risk, which is a risk that we see, and is a risk that you see on many sides of the coin and the spectrum. We have grant conditions. We do most of our grants, particularly in those in KEMRI and to others, through academic partners, and those academic partners are responsible for the day-to-day support and work with the centres themselves. So the principal route for us is the work through the grant conditions, which we've recently tightened. We continue to look at those, reflect on the cases that we see, and try and make sure they're as effective as possible. Your question about engagement and scrutiny of those organisations, we'd encourage research centres to be working closely. They do with the patient groups that they work with, but to reach further and to reach more widely and invite criticism and invite engagement. And it's something that we're grappling with within Wellcome too. We know right now there is rightly more scrutiny on the operation of independent charities and foundations around the world. We're working on how we can be as open as possible and invite our fiercest critics to criticise us as publicly as possible and start a conversation about why we do what we do, what we're doing, and how we critically get the transparency we need. So, there are things that we do. I'm sure we can do more, and this accelerator is part of opening that conversation at all levels and on all sides of the coin, all sides of the spectrum. So I hope that that's a conversation we can continue both after this session and moving forward. Jamie, question about country leadership and what can be done in countries. I'm not going to give us particular country perspective, but something that really matters to us is shifting the centre of gravity for research, leadership and prioritisation, so that we have decision-making happening in those countries that are affected the most and for where that response is needed the most. We're funding an organisation called AISA, based at the African Academy of Sciences, who fund to the same standard that we fund from London, and make those decisions from Nairobi rather than from London, from Seattle, from Geneva. We also, though, want to co-fund with governments. In India, we've worked with the Department for Biotechnology on something called the India Alliance, where we've co-funded, and over time the Indian government has funded more. So actually that's become more sustaining and more sustainable because of that partnership at the start, and we'd love to do that more. We spoke to the government of Rwanda about possibly doing it there and in other places, and we think that's a way where perhaps we can start on a 5-to-1 or 10-to-1 basis, where we're the bigger funder. But over time, if it works and if it produces that research, that excellent research, governments will fund more, and that's what we've seen. So we think that's a pathway too. Last point on your question, I think from civil society, it would be terrific, as Rosemary says, to keep stoking that demand. Please do remember that scientists are people too, and they need your support. So anything you can do as civil society groups to support researchers, to support them doing their work, would be hugely appreciated by those groups. And let's break down that divide a little bit. Final question from Sami on the GSK accelerator. I mean, one thing we do not want to do through this document is to try and make this to be the one accelerator that rules them all, because that won't work. That will be a disaster, I can guarantee it. What I think the future looks like personally is that it's messy but sustainable, that lots of experiments are happening with how you might pull sort of exciting ideas through and engage governments and engage sustainable funders. And actually, we won't necessarily add too much to that sort of very messy but vibrant ecosystem, which exactly as you say is getting more vibrant. What I think this can do, though, is to provide some of the underpinning enablers. So, for instance, putting the country health plan at the heart of that discussion at the start, so that you stand the chance of a more sustainable buy-in from the government that then might lead to more sustainable funding for the thing in the long run. So if it becomes more difficult for some of the other partners, you've got the public money there and the accountability and legitimacy that hopefully comes with it. And secondly, the WHO's role, offering guidance on where those shovel-ready, evidence-based innovations might be, and doing it to anyone, frankly, who wants to scale innovations. It's not a single final answer that's the only innovations we can ever look at, but it is a way of saying, here are some things that are exciting, that might work. I mean, one example I use a lot is this thing called tranexamic acid, which currently is used to deal with battlefield injuries, but actually, thanks to a group in London School of Hygiene and Tropical Medicine, could be used to stem postpartum hemorrhage. And child mortality and maternal mortality are indicators we're not doing very well on in all cases in the SDG 3 framework. And that medicine costs $2. So there are scalable innovations that are coming through trials, have the evidence base there. WHO is not the answer to everything, but they are willing and they can play a role in saying, here's some evidence and here's what might work. I'm sorry that was another long answer.
Thank you to all the panelists. I'm going to invite two very quick questions, if you don't mind, very succinct responses, because I realize that what we're doing by going a couple minutes over is not only hopefully enhancing the quality of the conversation, but unfortunately keeping us from a reception that the Global Health Council is hosting immediately after this. I'm the proud chair of the Global Health Council, so I do want to make sure we get to that as well. I'm going to take the one first from the wall and then here closer in. Go ahead. If there's a microphone, or just come up to the table then.
Thanks so much, everyone. You guys had some really, really fantastic examples about community engagement in achieving SDG 3. But one stakeholder I did not hear mentioned, which I think is important, is the youth, particularly when we're talking about innovation and new ideas and perspectives for making change. And with over 51% of the world's population now under the age of 30, it's clear we will not achieve SDG 3 without partnerships with universities, schools, youth professional associations. And so with the lack of a concrete youth strategy, what are some ways that your organizations are working to invest in the young midwife in rural Kenya or the digital health entrepreneur in Delhi to really work interdisciplinary and drive youth to work in decision making and implementation of SDG 3? Thanks.
Great question. And then last question to you. Remember, we're looking for succinct responses. That question you could go on for days, but.
Oh, thank you very much. My name is Tairo Sike, and I'm a public health activist from Zimbabwe. My question is centered around the accountability, transparency, and internal processes. It is very easy for us as civil society to engage with government officials outside our own countries. When we are here in Geneva, they are so friendly and we can engage. But when we are back home, there are no formalized spaces, and platforms, for us to engage with government officials. What we hear often is that it is a requirement of Gavi that civil society has to be involved. It is a requirement of Global Fund that civil society has to be involved. So there's shrinking space, not just in Zimbabwe, but across, the region. That's one of the biggest challenges that we are facing right now. And also, as users of research, very often we hear about research that has already been done. When you attend conferences where you hear presentations being done, even in communities where we are currently operating. So research is being done without involving civil society as users of that research.
Great comment. Really important to make. Two really important comments. I want to just give a very quick opportunity for the panelists to reflect on those comments and or one closing thought that you want to share.
Very briefly on youth, completely agree. We do support through IHSA India Alliance, sort of younger researchers. I think the single biggest thing we can do from the Wellcome Trust, though, is possibly to change and challenge some of the power dynamics in science and research that we sometimes see that makes it more difficult for you, if you're a scientist or researcher in your 30s and 40s, to have a strong voice in leadership and decision making. And I think in Wellcome, as a funder and as someone holding some power, we continue to challenge that dynamic. We're continuing to think about how we can do that, and we'll do more on that soon. But I think you've touched on something that's not only important for the SDGs, it's also really important for us in science and research too. On research being done and accountability, I mean, what we're trying to do with the accelerator, and we'll need your help on, is to create that conversation at a national level, learn from the CCMs and other mechanisms that exist already, and perhaps adapt them or use them where they do work, where they are providing a civil society space, finding the right place and time for a meaningful conversation. We want to get that in, and I think we need to make sort of more discussions to get that right. But that's certainly the aspiration, is that at that national level conversation, national health plan, SDG sort of goals, what is the gap and how can research help plug that gap? That's where we need your help and others help too.
Very quickly, I'm sorry I missed out on the youth because I had it in my notes. And NADA India works with the youth. They work through the peer educator systems. So, and they also use youth and media. So NADA India's real force and real working strength is working with the youth. That's one. The second response I have personally is that while I come here, but I'm still engaged with the process, which brings three or four kind of players and actors into play. One is a bank, like it is the CSR activity, which is helping to work with educational institutions, which talks about SDGs actually. So even before I came here, I went to Bangalore, the different metropolitan cities and the second-tier cities. We are engaging youth in a program where we talk about SDGs and development. And these are the youth change, these are the change delegates, right? And then they go into different NGO settings. And one of the aspects they pick up is health. So they take the SDGs and then they pick their SDGs and then they use media so that, so that's their task really, to use the SDGs, one of the SDGs, and then to use media and make small programs, and then they come back and then they will share. So that's one way of getting, and we are covering, I think, in this session, we are covering 2,500 youth all over the country. So we are expecting a multiplier effect to this. Mm-hmm. So yes, there are different ways of different stakeholders coming together and recognizing the fact that youth are the future, basically. Yeah, thank you.
Rosemary,
yes, yeah.
For shrinking space for civil society too.
Yeah, so just to echo the comments from my co-panelists to say that it's important to strengthen the youth engagement, especially within a shrinking space for civil society as well. So just connecting those two. But to say that in our networks, what we do is that we try to link with youth groups that have organized themselves. So we would either link with those or within our strategy, have a youth engagement strategy. Definitely more needs to be done. And I think more networks need to figure out a youth engagement strategy for that. Especially, I think we haven't tapped very well the youth in school, like university institutions. About the shrinking space of civil society, I think we can better it's really an ask. Maybe I don't have a comment for that. It's an ask to say that for the 12 organizations, let's see how we can better engage the youth. There are different models. We have the CCM model, which is all the way up to the country level. We have the Gavi CSO constituency. We have the CSEM, the Civil Society Engagement Mechanism for UHC20. That we have different models, and I think the most critical thing is to see that that kind of structure goes all the way to the country level and doesn't stay up at the global level. And my last comment is to say that for R&D, innovation and access, I think it will help us if we can start with the end user in mind, to say that who are the end users for whatever we are trying to do, and for the products that we are trying to come up with to scale up or to develop, we'll think about the accessibility, the usability, and the affordability of those products by the end users. Thank you.
Thank you to my tremendous panelists. This has been a really rich conversation. Thank you to those of you who provided comments and questions as well. As I mentioned, we're going to invite you to join a short reception with the Global Health Council and its delegation from many different countries, including many patient voices that are here, Jyotsna and as among them. So please join us for a short reception right back here. And thank you again to all of our panelists for everyone coming.